Unlike other anti-seizure drugs, Fenfluramine is the only anti-epileptic drug that has demonstrated the combination of effects at multiple serotonin receptors, as well as positive modulatory activity at sigma-1 receptors. The exact mechanism by which fenfluramine exerts its therapeutic effects in the treatment of seizures in Dravet syndrome is unknown. Other anti-seizure drugs exert their clinical effects through modulation of voltage-gated ion channels, including sodium, calcium and potassium channels, by enhancement of GABA-mediated inhibition, through interactions with elements of the synaptic release machinery, or by blockade of ionotropic glutamate receptors. Serotonin, or 5-hydroxytryptamine, is a neurotransmitter and neuromodulator that contributes to the regulation of various physiological functions. Dysfunction in 5-HT neurotransmission has been reported in epilepsy, and changes in the endogenous serotonin system have been associated with Dravet syndrome. Within the serotonergic system, fenfluramine may reduce seizures partly by acting as a serotonin releaser into the synapse, by disrupting vesicular storage of the neurotransmitter, inhibiting the serotonin transporter, and as an agonist at specific serotonin receptors in the brain, including 5-HT1D, 5-HT2A, 5-HT2C, and 5-HT4. Fenfluramine may also reduce seizures through its activity as a positive modulator of the sigma-1 receptor. Sigma-1 receptors are chaperone proteins, mainly located in the mitochondrial-associated endoplasmic reticulum in multiple organs, including the central nervous system. The physiological roles and actions of sigma-1 receptors in the CNS are multiple, including suppression of endoplasmic reticulum stress, regulation of reactive oxygen species, inhibition of the influx of calcium into the neuron, and reduction of excessive calcium. The modulation of many ion channels, including voltage-dependent ion channels such as calcium, sodium and potassium channels, thus affecting neuronal excitability and synaptic activity, and modulation of serotonergic neurotransmission, increasing neuronal firing activity. To find out more about the clinical effects of Fintepla in the treatment of patients with Dravet syndrome, please visit www.fintepla.eu.